2025. Come and have a unique experience in Dallas, Texas.
Ago Nanya Pete Milemia Pe Bemifa 32nd annual Ceana Convention Le Dallas Fort Worth. Dallas. Big D. Mifa Yapa Tepe.
Aha. Ceana 2025. Mano Bobo Edolo. Mifa Midwaza. We were me at the Cornwall Friday evening. Sunday me our picnic. Me our church service. And all les zanzazata miniva.
Tata nyo play before you, mi do bonso anamilo. Mi do bonso anami apata, mi de kukuna mi be mi kro mi afe famille ovalo. Mi kro mi afe famille o mi afa po Dallas da. Mi ado azan. Azalo.
Azase.
Azale kongbe.
Azale wow.
Hello. Indeed, Naminya Salao Klenukolao. Welcome to the Health and Wellness Hub in Miawekazo. Since we are in the month of October, we're still in the month of breast cancer awareness. Daniel Miakboy, we are all in our pinky today, and we are still propagating the gospel of breast cancer awareness. I have some beautiful ladies here who are going to help me do that. Indeed, here we have let me add them here. Okay. Miano Eva Boachi Echo Ghana, Ghana. All the way from Ghana. It joined me from Ghana, and she's a breast cancer survivor. We also have Grace Fafa Domepo. She's a nurse practitioner. And we have Ninette Doche Ajimahe, also a registered nurse. And we're going to have a very good and nice conversation.
Yo. Yawele Doju.
So we'll go straight to Auntie Eva Boachi from Ghana. Breast cancer survivor, breast cancer, survive elagbe. Tamanya bede na breast cancer kode death sentence emi now will know. She's alive, she's gone through it, and she's alive. So she's gonna tell us our story. Auntie Eva, over to you.
Akpe Yawele Doji. Abeleke ogbelenenia mekpo breast cancer epe wi adreke. Alebe medibe ma share new experience claiming la nu kware me keme no devi me nye student ya keme nya nu le breast cancer one abeleke ya mi susu ofifie be no nya po breast cancer ko kemi egome be ogbokukugbe vovon kemi no menye me le nyo susu me dadai ape me va po breast cancer novinge new cousin wameve o va po breast cancer oku alebe vovon ke mi to pete no menye ke wameve ho po breast cancer de two sisters onya new cousin ban toku abefe enemegbe avelia cheku alebe vovon ke mi no mi ame new brother glonambe ne mi jagba mi ba no screening wo yake vovo he no menyeta he ma yava was screening teme no vovo be wa va glona be me for cancer so we mi noji ono yi ne me le ma no enu ole po kake menye ke ma no le kaba kaba he be no chichi he bebe ma do menopause la me po be me no problem de opo o le be ma ikoji e me ikoji doctor o me no bleeding abe doctor o be mava no what test nam no kweda be cervical cancer ha e me senya kemi de chenye me ga ikoji o go me le vovon chenye nde ka ke me nyukura alebe menopause be sign we me no feeling don't have le nyo no me funny feeling. I would say funny feeling. Kakeno osigbe ko me no no lepo. E me no no lei. de kako me feel be nyo si kanane abe ku ye me le shio ya ke me no nu khlele breast cancer un tai e be ne me ba wo test ma mulain flat a me cho me ba mulain me ga gbugbo ga le po me po be e ku le me e un ke ko ya me de koji me von alegbegbe alebe me koji me do doctor gbo pra me no avifa ya doctor ba wo examination onam no de kate nye be he ma do menopause nye me tasi asido do anyi kaba albe doctor biam egblo nam be nu ke mi temenyo nu ya biam be nu kata nye me va koji kaba ha ya me gblo ne be me bi koji doctor obe nyo hormones we le dowo ya ta nye me tasi kaba alebe bi ba wo biopsy over lost sample wele nyo no me ya over do ipo ya over glonambe doctor yom ya glonambe opo cancer cells wole me ta ehia be ba o treatment lanu kwale me zigbanto me doctor go me favi doctor bia nyo history background pete me glene be me lose nyo cousin wa me vet through breast cancer alebe me favia bien be nu ka fa me le ha ya me be me le vovon be ma ba ku le vinyo ogbo ya obe ya deji fo na be nye ma ku because technology le fifi ta I shouldn't worry me to le fi mi am va isofo gbo bien o sofo che gbo me ba gble na sofo che deji fo na mi dogbeda ale be me ya pe me abe sofo le ko ayom le phone di mi adogbeda mi a sofo me no by then me no kumasi ale mi a sofo nye sofo boni nya nyonu enye nyonu ta e me gblo nya ko ya che se me nam ale be edogbeda klim mi no gbedo da for mi once a while ayom mi adogbeda yin to che me no gbedo da ape me no koji de tai ko nya do na be ma va koji ko me va yi abe over wo surgery nam ba wo surgery na doctor ba wo surgery na no e ke ho ozube me po e kabata ke me yila o me la enu opete o apa ke mi he e ko le ya ko la ka en la vida pere be possibility le be e root do ya fido ta o kan la vida pere abe nyu no va so abe half of the breast alebe o wo surgery na mfo ya o lebe ma va wo chemotherapy over na me wo chemotherapy for ya va wo radiation che for about 25 days every day weekend work we me lemon every day you have to go in me wo chemo it was so horrible chemo was sesen wa through wo nu me na wa bi tefe wa bi taflache wo nyonu me ata me wa bi mi to pete me gbedodora mi latike wo eda pete vole wo ta mi wo ke mi to pete vo ape ba ide machine maison le confort noche ya te mi we for 25 days wa de o machine me on radiation wo na o mi wo ya te vo ko yi atike ku me ba no ya to be hormonal hormone booster drug me no ya che for one a day for 10 years
Wow.
ape ppa nu iji kumele multivite pli nu ti oji kumele ga ke periodically elebe ma ikoji no what test now along the line time there me va change doctor me ma po doctor de bubu te be view o be yo po be cells o be ne yo gava ga ke ma ka yin yo doctor gbo me va yin yo doctor gbo o gava dam de chemo drug ji ga ke ya de menui o me do na mo ta nyo da me vo Megaba wo ya che about 12 weeks. Me wo ya voy. Ya megale. Recently mega you check up. Mega ga for doctor bubu te be view da. Ya check o ga be cells e ga gbo. Mi ga wo test we ba wo MRI clean of your pete ya be ao. Cells e me gbo. Everything is okay. Alebe so far so good. Mi le mausi for the past 17 years, but periodically me yeva wo test. I check out for this October, remember spring, you know. Along the line, Doctor Kehe wo, I think ye nam le kumasi ben konye Doctor Mrs. Beatrice Wiafi Adai. Yai ko maglobe yai ko awareness to le cover Ghana. Na Ghana toy, especially nyonwe. Albe eko megaphone ano egbepade anami ano amowa no yi ono treatment wone to hospital time ho was surgery na mo eko ke me theater ke me was surgery te o me roof ho was surgery na mo ka ke fifie a mekesinu heva abe let me hayala and we are regarded as survivors. We form association that like Europe hospital la or you the Peace and Love Hospital ele odium le Kumasi alebe me form association Peace and Love Survivors Association every October la we will walk let the federal chacha from region to region this year we will jisu abe we will walk at the Bepa otia mi amedewe le survivor ome be let me know amo council that anytime for you back hospital ko mi atemi ai hospital no po amede with the cancer cell wa do dem mi agbo mi cancel adeji fo na egon be amesia me feel be no impo cancer ko ezu avinya amo wa no avifa bovon abe no mi afonu na wa deji fo na come here first story ati nawe let me now see bevo we follow them me a hobe number ano yo kaba akpela ba la tike o ha atike wo wenyanya o dekodia o surgery nawa o la tike wa o iba o kimwa ya no inu mi to akpogbo be de o ma miss treatment you albe mi ameroche o misigbe be mi counselor and we've been counseling them the newly diagnosed patients. So far, so good. Ya Jimile, this year, last weekend, meet the Jusu over our walk. The awareness is still going. Megblobe, thank you. October, ya was surgery now. Came at the that October. There wasn't even any pink around. We didn't know about any pink. Hako refer to breast cancer. The awareness has come so far. And then October, our pink ribbons are being put. Let the bank where institutions where all propagate is so much. But so far, I think it's going. Mileji, yaji mile.
Wow. Akpe. Wow. Tamariko, how many years, AK? Since 17. The day you were diagnosed. Since the day you were diagnosed.
17. We are there 17 years.
Wow. Me that when I'm out.
Amen.
And no, the kako online. Is it was it the kako?
Online. Omela no peteo. Finike lamp lady. Ole o de lamp alba online and lade flesh that pedal alba compared to the correct breast is about half. Okay. This one is about half of this.
Okay. Oh wow. Wow. Me that now kaka. Thank you for your story. Menyabe, your story has inspired me so much. Menyabe, at this time they have hope because all of us 17 years. Okay. Omekuo, you're still alive. You are alive and kicking, and you are creating the awareness. You are not selfish. That is the key. One key, Emi Onami, early detection. Early detection.
Amedode. Ome dibe no nyabe yo jedo.
Yeah.
Yata no ben mi va glonyate. Edo wan ben no konu buyo ben kume fene yo fonu.
Yeah.
Amoma dibe ne yo yikura no kpo iwo. Kake you may feel but no jira o dodi. Ya mereche na play now. Akpede nwu.
Yeah.
Albe nye me kwa me se me ko I talk to them about it.
Akpe, thank you so much, Akpe.
Akpena mi aote.
We are grateful
Mi
to
awele
you.
dodi.
You're to
you.
Ghana,
Thank you.
KKKKK, and you're telling us your story. That we really
Yeah.
appreciate you. Thank you so much.
Okay.
Miracle Auntie
Akpena mi aote.
Eva Boachi, Eyawan
Yeah.
all the way from Ghana. Okay,
Yo.
we'll take a short
Bye bye.
commercial break and we'll be back. Thank you, Auntie. Okay.
Thank you.
ɖe wònye wòdre kuku kple taɖodzi be yeawɔ dɔ abe lãmesẽdɔwɔla ene ɖe nele klalo be yeaxɔ hehe yi ana be mɔnukpɔkpɔ nasu asiwo be nawɔ dɔ abe lãmesẽdɔwɔla enea ekema mɔnukpɔkpɔ va na wo be nato kɔsiɖa eve ƒe hehe nana tɔxɛ yi ana wo ɖaseɖigbalẽ be nate nu awɔ dɔ le New Jersey le yevu dukɔ me tɔwo koe nye be naƒo ɖokuiwo ɖe hehe nana tɔxɛ ya me yi dzi New Jersey Board of Nursing Dashido nufiala kpɔ nuteƒewo le lãmesẽ nyawo me akplɔ wo ato hehe nana ya me woafia wo afɔɖoƒe tɔxɛwo kple aɖaŋudeto yi ana be nuteƒekpɔkpɔ na asu asiwo be nawɔ dɔ le xexea me godo le hehe nana ya ma woa ana wo mɔnukpɔkpɔ yi awoe be nate nu ade nu yiwo katã srɔ̃m nele atome enumake eye le kɔsiɖa eve megbea ɖaseɖigbalẽ asu asiwo be na awɔ dɔ akpɔ dɔnɔwo dzi le aƒewo me yi nye home health aid megana be mɔnukpɔkpɔ ya nato nuwo ayi o tɔwo koe nye be nayɔ kaƒodzesi yawo hena ŋkɔŋɔŋlɔ alo nenye be egahiãna numekɔkɔ bubu yɔ 862558464 alo 848-218-1555 atenu agayɔ 773-960-5416 alo naro email ɖe pccshhtrainingschool@gmail.com alo newmanpccsinfo@gmail.com tso kaba megana be mɔnukpɔkpɔ ya nato nu wo ayi.
Yo, hello, our viewers. Akpenami, thanks for watching us from Ceana Media on YouTube, Play, Facebook. We are live on Facebook as well. Really live. At this point, I have some beautiful guests here in the studios with me, who are going to help us digest this topic of breast cancer. Beautiful professionals, healthcare professionals. I have Grace Fafadwa Mekpo, a nurse practitioner Onye. Yeah, I also have Ninette Doche Ajimahe, registered nurse Onye. Opete, they belong to the Ceana Nurses Association. Ceana Nurses Association. Daniela Mianko say, and you're a nurse, and you're an Ebe, and you're part of Ceana Medekuku, you have to join them to continue doing the good and great work that you're doing to help Ceana. Breast cancer. Miledo, what at all is breast cancer? Over to you.
Okay. I'll go. Breast cancer, when we say breast cancer, it's just when normal cells in the breast grow and they grow out of control. And that is basically not just breast cancer. Any cancer is just if the cells wherever it is growing, when they grow out of proportion, that is what we call cancer. So when in terms of breast cancer, it is just the cells in the breast growing out of proportion.
Oh, okay. Akpe. That we say, it's just the cells growing out of proportion. Breast cancer, how do we get it? How does a person get breast cancer?
Okay, I'll take that. Okay. Breast cancer has so many I mean, there are genetic factors like how she just told us, our survivor just told us that she has a family history. That's one way of women, especially when you have young women, young adults, they just had babies, they're dying in their 30s or 20s or any age in the family. That means you have a very strong familial history. Those women are the number one, there is something that you're doing, or there's nothing that you have done. It's just the family where you come from, they have the abnormal genes in their cells. So when they are growing up, they have more chance of developing breast cancer, just like Auntie Eva just told us. She has survived it, but some of the women in her family succumb to it. So when you have a family history, that's one of the reasons that you may develop breast cancer. Sometimes it's also, it doesn't really have to have any reason. You don't have to have a reason. Lifestyle can be one of them. Drinking, smoking, not taking good care of yourself. And those are all part of the stuff that makes you become susceptible, because any lifestyle that you lead and you are not taking care of the cells in your body, doesn't matter if it's your breast or anything else, that may even make your cells get up out of the way they function. So the too much proliferation, or like the dividing of the cells, the way every cell in your body has the way it matures, the way it comes up, divides and do that. But once anything kind of interferes and it starts to divide too fast, that's how it comes about. So any lifestyle changes that you have to do, that is acute and can destroy some of the cells, like drinking and smoking are one of those things. So those are some of the causes of it. And then environment. The environment we are in, toxic stuff, working in areas that you are like even chemicals. When you work in chemical companies, in the mines, mining, that can give you different kinds of cancers. And also, it has been said before that women that have not had children and breastfed children can also develop breast cancer. Cancers may not start from the breast, but they may spread from other organs into the breast, or the breast to other organs. So people that have normal cancer from other areas like the cervical or the fallopian tubes and stuff like that, it can also go into your breast. Those are all ways of getting it.
Wow.
Sister Fafa, if you have anything else to add to it.
I think it's said it. It's mostly about life changes, stress, not getting enough sleep. They can all lead to that. It's not just about gaining weight and it can also lead to cancers.
Wow. Akpenami. Thank you. When Auntie Eva was talking, at the time, she made mention, Bede, breast cancer. Yeah, over the years, Chede, I've realized that breast cancer, the men think they're not part of it. Is it only women who get breast cancer?
No, it's
No.
not. I actually learned this when she mentioned Konfanochi. That's where I trained. I'm a Kumasi trained nurse. I did every my nursing and midwifery in Kumasi, so that really made me proud that they were able to treat her and get her, surviving for 17 years now. I actually had a patient when I was student nurse in Kumasi. To be, right now I'm not in Ghana, but if you are talking, they would think, okay, you are talking about people here. But no, in my very early training, like my second or third year when we're doing clinicals, a patient that I had was a male, a very proficient man who was diagnosed with breast cancer. And I had him in either B1 or B2. Those are the male and female surgical wards. And he had surgery. They had to remove the the tissue in his breast. So it's not, women get it more, but men are also there in like 1% of people who have breast cancer. So it's really until it touches you, especially men with a lot of breast tissue. You know, some men, you think they are growing their breast. People have their breast tissues in different categories. Men, some of them have just very few breast tissue, so their breast doesn't develop. You don't see it growing. But some men actually have their breast showing in their, outfit. You can tell this one has more, and those are some of the men that are more overweight. So the tissue also, the more you have, the prone you are to having the breast cancer. Although in women, that's not really the factor, but obese people tend to have more cancers than normal weight women.
That medical, in that case, are they also supposed to be going for mammogram or just doing the self-breast examination?
I think since breast cancer runs in families, we are not sure about the male one, if it really runs in families, but there's not much statistics like it is with the women. But anyone with a family history of breast cancer should talk to their doctors about, oh, my uncle or my dad died or was diagnosed one time in his life with breast cancer. What are my distance? Everyone can also, even wives and husbands, okay? If you are married, you have a boyfriend, you have a girlfriend, if their breast, you can't just use it for sexual stuff. You should know that you want your wife to live long with you. No, the truth be told. Because sometimes men are only looking for their pleasure with their wife or their girlfriend or whatever, right? The moment you know how to touch a woman's breast, you should feel it and know that that breast is for you to also know if there is a change. It's on both of you when you become a couple to make sure that that breast, if you feel anything different from the woman, you should be able to say, oh, I feel something here. Is it okay? The woman is supposed to also, or the man is supposed to do breast exams themselves, and it's vice versa. We are not going to just be polishing it as if it's just clinical stuff. Some men or women have detected abnormalities in their wife's breast or the way it looks in the mirror when they're in the bathroom trying to dress up, and told them, and they've come up to say, oh, my husband said one breast of mine is longer than the other. It looks more puffy on one side, and the woman has now realized it. So all that comes to play, that it can help. So they have to check their breasts every month for women. I'm sorry, I didn't have enough rest last night, so my voice is gone. I came up very late, so sorry about that. Yeah,
that's okay. Your health worker study. Yes, you work long hours. That we understand. The American intro, let's say, in echo breast cancer, you have to be doing your self examination too. Okay, please go ahead. Papa wants to ask.
Makonya de kademe ya nyeme miape association ye Kenya Survivors Association ke me have we. Utu de kache no miame. Yes, survivor. Ever for treatment periodically. Like unfortunately ever ku.
Oh wow. So rest in peace. Yeah, and personally, about I think 4 years ago, I just had a similar program on TV, and I interviewed a man all the way from Ghana, a survivor. And he also came to testify, just like Auntie Eva is testifying right now. A survivor. And I know another person too in Ghana. He's also a man, an older man. He's going through the all the chemo and whatever it is to get it out of his system. Intro, you're not left out. We also have to be checking, your breast from time to time, to make sure you don't have it as well. Very cool.
For the men, there are some medications that men take that make their breast look like it's swollen or it's like there's a drainage coming out of it. So that can also mimic breast cancer. But what I want to say is, whenever you see that, you still have to go for a checkup, so your provider is aware if it's not the medication that is causing that, if it's a real cancerous cell or it's just the medication that is causing that.
All right, akpe. Mile dobe, we have to check. Medical, if self-examination, how do we go about it? Well, is there any particular way, we should be checking it? I mean, from day to day or time to time?
Yes. Usually what we tell women is that when you are every month, okay, you can't go to your doctor every month, but we want you to pick a time if you're still like menstruating, having your period and all that. We want you to check your breast tissue after your period, because just before your period, from ovulation to your period, is when your breast becomes very tender. The hormones are at their highest point, so it actually gives you tenderness in your breast. So if you're checking it at that time, it may be painful, so you may not do a good job of it. And then so once you finish your period, within that, so you can pick a date, let's say second week or 10 days after your period, the day you start, 10th day, that's when you want to check it, or 8th day. So anytime you have to mark it on your calendar to say, oh, my period came this day, and then you are aware when to check it. So you find a time when your breast is not tender and you check it. So we actually ask people to do it also in the bath. When you're about to have a bath, you have your soapy hands. That's also a good time to look at it. And then they tell you to lie down. So you want to be flat on your back with the hand that you're going to use to check the breast, or the side of the breast that you're about to check with the opposite hand. You put it behind your head. So your chest is flat and you can feel the breast tissue from, you go clockwise or anti-clockwise, wherever you do. You try to go from your armpit of that hand and do it around the periphery of the breast, going inward. And then once you finish the circle, you come to the nipple side and then check it. And by just kind of, it's like not squeezing, but kneading, like how you run your hands through, but you feel it into the tissue, like you want to feel your ribs or your chest wall. So once you do that all around it, you're going to find little lumps that are normal. They are not hard. So if you feel anything that is like, it feels like a frozen piece, something really hard, it's not usually very soft tissue. Soft tissues you can push through and you can feel that, oh yeah, this is my own breast tissue. But if it's different, you can feel it. It can be very small, like a pea, or it can be bigger. So, and if it's painful than normal, it may be painless too. So that's how you do both breasts, hand behind your head, and then you do it when you're lying down. And you can do it in the bathtub, where, like in the shower, actually, where you just use your hand with the soapy hand, so it slides easily on the breast. So that's another way of checking it.
All right, thank you all so much. Thank you. Auntie Eva, how was your support system like? Sometimes the people around you, it counts a lot. The support that you get also helps you, recover fast. So how was your support system like?
Oh, in fact, support generally, treatment of cancer is very, very expensive. Albe enabe amono ojegome neme support meleva vako otole moji atike okwasi insurance ke national insurance ke kidna support mi chen atike okwasi ko insurance meta help it you. It meets us halfway. Okay, especially with the drug, but not with surgery or anything of that sort. Okay, let Tonya go, man. I'm blessed. I have good family. They all supported me. My brothers and sisters, my siblings, my nephews, nieces, everybody around me, they really supported me. That even though my led daughter me feel me led because they were always around, checking on me. Akwera be eleke mele. Nenye be here gala, una gam, meko platike, udro gadam, meko wanusia no kefe ulebe mawo. That in my case, by the grace of God, I have good family. My family is very good. It's very good. And we are very supportive. We support each other. Tale tonye go me mesesan. Like generally, sometimes I will have some drugs. New nephew they call US. Apla tike rodam to US. No play rodam no suboko. Kemiele bemaga yo survivor do whichever kwatike de whichever hode. Then I give them some of the drugs. This is how I went about it.
Wow. We thank God. We thank God, Barry, you had a very good support system. And we are praying every day. Anybody going through this day, they also get a good support system, people to help them, people around them to comfort them, you know, to help finance them as well. Here. Yeah, thank you all so much. We'll take a short commercial break. Don't go anywhere. I'll be right back.
Hi there. I bring you good news from Green Safe Consult. Here at Green Safe Consult, we have titled and registered lands for sale at Oyibi close to Medina Municipal Hospital for 150,000 Ghana cedis per plot. We have lands at Akuse and it is 5 minutes drive away from the Akuse Junction, going for a cool 50,000 Ghana cedis per plot. We also have lands at Amrahia behind the Ministry of Fisheries and Agriculture for 150,000 Ghana cedis per plot, lands at Ayimensa for 250,000 Ghana cedis per plot, and also lands at Afienya going for 120,000 Ghana cedis per plot. We do have lands at Oyibi Hills, which is 10 minutes drive from the Valley View University, going for 80,000 Ghana cedis per plot. We also have lands at Pediasi West, going for 150,000 Ghana cedis per plot, lands at Malajo, going for 450,000 Ghana cedis per plot, and also lands at Ebri, going for 20,000 US dollars per plot, and many more. You don't want to miss out this opportunity. Call us today on 024-444-4611 or 054-8754-317, and we will be at your service.
Hello, welcome back. Welcome back to our viewers and our panelists here at the studios. This is the Health and Wellness Hub. Ms. Del, and I have in the studios with me Auntie Eva Amabuachi, right from all the way from Ghana. Eva, she's telling us her story. I also have Fafa Grace Dombepo, who is a nurse practitioner, and I also have Ninette Ahemaji. Did I mention it right?
Ajimahe.
Forgive me. Ajimahe, who is also a registered nurse. Thank you to our viewers watching us live. Ruby Amegbo says, praise God. And then we have Irene Allo also saying, we thank God. We also have Steve Day saying, great presentation. May I ask, Diane Ninette talked about self-examination, and it has been said that one of the ways men can assist their women is sucking of the breast. Does that help? Is it true, Auntie? Ninette? And to all open it. It's the sucking of the breast.
Okay, stop, Papa. Can you answer that one?
Really? Well, it appears studies have shown that sucking of the breast helps. I've not really taken the time to actually look into it, but yes, that is what studies have shown. Yeah. But so if you want to suck it.
Uh-huh.
Go ahead.
Is it the sucking or the touching? Because
It's
can you feel the lump when you suck it?
so
Or is it
so
touch?
I think what they are trying to relate it to is apparently when you are a breastfeeding mother, it helps prevent you from getting breast cancer. So I think that is what whatever I read in the past, that is what they are trying to relate it to. So what can I say? Every sucking is sucking. So if they want to suck it and they think that is going to help, why not? But I actually did read I read an article that said that sucking of the breast, it helps prevent breast cancer.
That,
Yeah.
and that means that when they suck it, they have to touch it as well. So if there's any
Of
lump,
course,
yeah.
It's free touch first.
of course,
They'll definitely
of
touch it
course.
though.
So yeah, so to also talk about the breast examination in that, of course we are privileged. We are in the United States. We are privileged. So some of the insurance companies will call you and ask if you had your mammogram and all that. So according to studies lately, the self breast exam alone is not what is needed to actually let you know that you have breast cancer. The gold standard here in the United States is the mammogram, because they've noticed that just doing the there are people who do the self exam and they think there's nothing there. They go and get a mammogram and it's like a full blown cancer. So what they are doing here in the United States is they use the mammogram more than just the self examination. Of course, back home is a whole different story. Mammogram will go. But what is advised over there is we need to be mindful. We need to go and get our physical exam once in a while. It doesn't have to be a yearly exam. Whilst you are doing the breast self exam at home, every once in a while, yearly, 2 years, you can go and see a doctor so they can examine you well from head to toe, especially the young ones. It appears in Ghana, the young ones get more breast cancer than the older ones. And they are the ones that are more prone to dying than the older ones. So it is good if you can get a doctor to just go and get a full physical exam in Ghana.
Yeah, yeah, it's true. Well, because I know of a couple of people who have died out of breast cancer in Ghana. I'm like, why? I mean, though they were lucky to detect it early. Gake, they didn't take the necessary steps. So, they are just praying. They were just praying,
Oh
praying,
yeah,
praying. They
that's
got to the stage of it got rotten and they died out of it. That's so sad. But early detection is still the key.
Still the
Okponoin,
key.
just take the steps and go get checked. So you can take whatever medication, to get rid of it. Yeah, Akpena is true. For Steve, but okay, thanks, Dafafa. We love you so much. More sacking, no men.
so
We also have Lucky Amenume. She says, "Good job, ladies. Thank you so much, our viewers. Akpenami. Thank you all for watching. We're still on the Health and Wellness Hub. Every Saturday around this time, we are live. We are live. Keep watching us. This is Ceana YouTube channel. Please subscribe if you haven't subscribed. Merikuku, subscribe, yes, and watch us and share the link whenever you have the notification. Share the link. We have a lot of programs. Right after Mia program, we have Ceana Central coming on. For Steve and Mama Seduji, they come away with Ceana Central. And then after Ceana Central, we have Dunenyo Boboba Show by our sister from Ghana, Sister MFA from Ghana. And then after that, we have Miss Robegbe. Miss Robegbe. We are all struggling with the Begbe. Let's all log in and then learn Miss Robegbe. Then Sunday, Mia sister Nicole comes our way with Afrikuchu. She comes our way, they're teaching us our culture. Ele mi wona mi head everyday go our marriage ceremony. So menyao, mi amedo menyao ta. She takes us through all this, and we are grateful to her. We have a lot of programs lined up. Friday, We have our own DJ Mawanyega who comes our way with the African jazz and traditional music panorama. That last night we were privileged to enjoy some great music. That is also on Friday evenings. Friday evenings. That's 7 p.m. CST and 8 p.m. Eastern Time. We have a lot of programs on Ceana, media, TV, and radio. We have a lot also coming up, so just be on the lookout. Akpanami, yes. My sister Mary Asari, good job. Akpanami, thank you all for watching and listening in. Yeah, this is the health and wellness show, and we've been talking about breast cancer. Breast cancer. So breast cancer, there might be how common is it? Okay, these days, how common is breast cancer?
It's very common than we think. Yeah, it's very, very common. I can relate it in Ghana. It looks like I don't have the real figures for 2024, but as of 2020, it appeared that it's recorded that 4,400 cases were recorded for breast cancer, and it is like the second most deadly cancer in Ghana for women.
Wow.
Yeah, and usually, apparently, the survival rate within 5 years is about is only about 48% of people who survive from the time you are diagnosed with like breast cancer to the time you die. It's about 5 years. As of this is data from like 2020. I don't have the real data for now. I know these days there are more medications, there are more ways of making sure, yes, but it's still the second most deadly cancer for women in Ghana.
Wow. And what are the treatment options, huh? When somebody detects better in the or lamp me allow a self-examination and they notice something and they go to see the doctor. I think they are giving options, right? So what are some of the options that they are giving to treat breast cancer?
So, okay, yeah, go ahead. Yeah, go ahead.
I think it depends on what stage it is. First of all, when they notice the lump in your breast and they determine it is cancerous, they need to go back and stage it. So when it depends on what kind of stage it is, but I think some of our sister Eva said, there is chemotherapy, there's radiation, and sometimes they combine the two, chemo, radiation, and sometimes they do surgery just to take the tumor out. And then and these days there are oral medications that people take as well. So it can be a combination of any of these to get rid of the cancer. This is Annette, you can go ahead.
Yeah, so the other options is that when they're staging it, once they take the biopsy and everything, they do so many things in the lab. The doctors want to find out if this is involved with your hormones. Is there any hormone receptor involved in your cancer? They come up with everything, from the staging, and everything that they have to do will determine what it's like a custom made treatment for everyone. Everyone is different. So like Auntie Eva said, she went through the chemo, she did the radiation, and then she went back for the hormones. So not everybody qualifies for the hormonal treatments. Okay. Some do. So once they come up with what kind of cancer you have and what kind of hormone they can suppress, that's when they go for the hormonal treatment. And they do that mostly after treatment, and then to just kind of kill or reduce the hormone that is really making your cancer grow faster. So that's when some people get the hormone and some don't. And I think, and then they can also determine if your cancer is spreading faster when they do the staging. They know all those stuff. And the other thing that I can also add to it is that we are only talking about the mammogram and the self-exams. Some breast cancer may also come in when you just see signs. You see your nipple, you haven't had a baby, but here you are, your nipple is giving out milk or some discharges. It's very one of my a colleague that I know, her mother had a baby like 40 or 30 years ago and said, my breastfeeding never stopped. Since I had my last child, I've been having milk in my breast since then, and not knowing she was having breast cancer. So anything that comes out of the nipple when you are not breastfeeding, you shouldn't see milk. When you are not, nothing should be coming out of your breast anyway if you are not breastfeeding. And if you see bloody stuff coming out, that's a sign that something is not good. It's either an infection. Don't straight away also think that it's cancer. You need to see a doctor. You need to do the mammogram and make sure that you're getting the right treatment. And if you're not satisfied with your doctor also, can you please go to another doctor and hear what the second opinion is so that you can be comfortable with your choices. This comes to you making a choice of what kind of treatment you want to have. Some people may not want the chemo because they think, okay, if this is so spread out in my body and it's going to kill me or it's not going to give me that survival rate that I want, I'd rather enjoy the life that I have. But the other thing that I really wanted to bring to light is the the prayer part. You cannot only rely on your priest without involving your doctor in your treatment. You should also, because I can see that as one of the biggest things that happens in Africa or in Ghana that I know of. People are having other illnesses and they end up in the Osopho's house. They are in the Osopho's yard. Mental illness, they are there. Now you take your cancer there, what is he going to do for you? You need that prayer to support you. It's a support system, just like Auntie Eva said. When you are taking the step, God helps those who help themselves. If you pick up the load, God will help you to put on your head. So if you don't go to your doctors and you think that Osofo, you're giving him money, you're doing everything, he's praying for you, you're buying prayer, it doesn't work that way. You have to add prayer to your treatments and not just treatment by itself. So I want to encourage my brothers and sisters that are religious and the priest also to actually direct their congregation to go and get checkups, to come back to them for prayers, but to also get treatment first.
Wow. Thank you. Go ahead.
To add to what Sister Ninette just said, this is not just like let me say people who have not been educated. These are educated people who are sitting in church homes or whatever congregation, trying to let God, Jesus heal them. We have to know that no matter what it is, and this is not just for cancer, it's about every illness in Ghana. I've noticed that even the educated ones, they go to the doctors and they don't even ask questions. Whatever they tell them, that is fine now. I think that is Ghanaians or Africans. I don't know. Let me talk about Ghana. Ghanaians need to know that the doctors are there to educate them, to help them. So no matter what, if you have a doubt in your mind, please, whenever you go to the doctors, just ask that question. Don't feel that they are going to be intimidated. They are there. They are collecting your money. So you should be able to ask them questions and let them educate you before something else, before it becomes worse.
And I think our doctors also, to add to that, our doctors have to also change the way they have conversations with their patients. Because before, in the past, they are like God. They're seen as up there. You don't have to ask your doctor a question. Whatever the doctor says goes. But life we've come so far. Our parents should know, our sisters should know, everyone should know that when you go to your doctor, it's a conversation. They do not see you and predict what is wrong with you. You tell them why you are there. So they use your own words to kind of, diagnose you. So you tell them you're having a headache, they'll look into your head to see what can be wrong there. They're guess working with you until they do that test and come back with a result. They don't know. They're actually telling you what they think is wrong with you. But you are the one who goes there to tell them what is really wrong with you, and they are diagnosing you, trying to treat you. So if you don't have a voice with that doctor, you're wasting your time, and you may be dying from something else without asking questions. They'll be treating headache with Tylenol for you when maybe you have a tumor or you have something, blood vessel is breaking in your head, because we send people in and there's a clot in their brain. So severe headaches are like, so you just go and they give you Tylenol or ibuprofen and you go home, you go and sleep and you die without waking up. So we need to ask questions.
Wow. That's a lot of information we've had this morning.
Right.
Even from the layman's point of view, sometimes I say that when I hear all this, like, why is it that when you have breast cancer, why can't you just go to the doctor and say, okay, just cut the breast off and let me be free? But it doesn't work out. It doesn't work that way. We've had a lot of information. Early detection is key. And then when you are you've detected something, you have to take the necessary step. Go and see a healthcare practitioner, a doctor, a gynecologist, whoever, for the start, So you take the steps in treating the cancer, So it's very, very important that Akpenami. Thank you all so much. We have one last question from our own president, Ceana president, Dr. Tatwinya Madi. He says, great job, Ms. Dell. Quick question. Is there a special way to suck the breast that you and the team can recommend? Dr. Lebebialo, is there a special way to suck the breast?
No, I just feel like
Dr. Nyamadi,
that question is the topmost this thing that they are taking home, but we don't want them to just relax, like just relate to that. We want them to know that they themselves have to start, checking their breast and letting their wives suck their breast so that they can detect the cancer in them too. But then aside from the breast sucking thing, right? The breastfeeding mothers are the ones who, if they are sharing the milk with their husbands, maybe they are getting the benefit more than just a breast being sucked. So that's the statistic we really know about. But there's also another detection that I'm not sure if it's in Ghana, that people like Auntie Eva's family, all the young girls coming up from the mother side or whatever that are getting breast cancer, there are tests you can do, blood work or saliva, that they can detect what kind of cancer do they get. Are they prone? You don't have to wait to be 20 years, to know that you have to go for mammogram, to go and do all those things. You can, as the moment your hormones start coming in, you're having your period, before you turn 20 or even 18, you can go, because breast cancer does not start quickly every time. So you can go and get this blood work, which is the BRCA 1 and 2, which is just a simple blood draw. I'm not sure how much it costs, but they can do that, or even just the saliva from your mouth. They can actually detect if you have the mutation, if you have that gene in you. That means you're prone to having breast cancer. And I've had a colleague who cut off her breast, by both breasts, because her mom died at 35, her auntie died at 32 or something like that. So she cut both of her breasts off before she turned 20, and then did start, the prosthesis and all that. You wouldn't know that she had it, but the day she told everyone, whether you were 30, because they were recommending 40 years for people to do everybody went in, to go get theirs done, the mammogram, So if you have such a big family history like Auntie Eva, you should be looking further than waiting to do self-breast exam when you are in your 30s.
Wow, thank you so much. All too soon, our time is up.
I know.
And 1 hour went by so fast. Thank you all so much. We've had a good time. We have Alice Hayes on there. He says, good job, ladies. Good job. Thank you all for watching. All too soon, our time is up. This has been the Health and Wellness Show and on Ceana TV, and we've been discussing breast cancer. We've been here, and our ladies have helped us to create the awareness. If you're out there, please do your self-check from time to time and go get your yearly mammograms done as well. Thank you all so much. My name is Ms. Dell, and we'll come your way again next Saturday, 10:30 Eastern Time, 9:30 a.m. Central Standard Time. Thank you, Ms. Fafa, Grace Dombepo, and Ninette Ahimadi. Why do I keep
Ajimahe.
Just say the
butchering your name?
It's Ajimahe like Ajimahe.
I'm so sorry.
It's okay. Yeah.
Akpanami, and thanks for watching. And we'll see you again next week. Bye-bye.
Thank you. Sure. Bye-bye.
Yes, ye KKC, Akakafo, Aroji Orokogo, a Fuati Agamabiesa, Anyani ato Junkling, Makarananamchi, Manananya Kui, Yenaba, Ashipali, Hikala Angama, Floss, Tasty Treat, Anyashipali, Azina Azada Shiada, a Putapeo, a Snodapeo, no never a Jigazandum, Nano Banaba first course. Hello, starter. Enya no ngudu ika no nyaba na ajibaya anokwa ma yema ajibaya dum papi adakwa. To ko nyaba na ji Flows Tasty Treats product here. Dikanya ashitali. Ade ya ala nu goma. To ko nyaba na ku. Na ku de. Na se baba akwedam. O pro pado strong pajio nyano adudum. Anu na ma share da. Ji Flows Tasty Treats. And you know so engagement, wedding, official fee can hear me a pogger alaba one for. Airtime novinger, Jagaba, Bohana grabber, one or show. No jumla mojide. Jagana Tashida www.Flows Tasty Treats. Go there 212-915-9331. Jagaba Naji Flows Tasty Treat. Then I call Adada Wapa Doma, Yanobutu. Flows Tasty Treat. I like the Flows Tasty Treat. I don't know, I'm at the corner shadow. Flows Tasty Treat. I like Ayo like Gazut. Giomo, Yahama Lakana how. Flows. Oh, Aloha. Okay.